Good morning. Today we're going to be looking at, for Module 5, the assignment was to look at some of the various tools and posters, slides, etc. that I have created to implement my project that we have spoken about in the last couple of weeks. As you are well aware of, my project is going to be on the early recognition of sepsis among med-surg nurses, and with the hope or intention of implementing a hospital-wide project following this practicum where we can actually try to implement some sepsis protocols in place among the physicians and the nurses there. But for this 8-week practicum project, the goal was to have early sepsis recognition among nurses. So the goal is pretty much just to have these nurses have an understanding and awareness of what sepsis is, what sepsis is not, and how to identify sepsis with their patients, and to begin just thinking of that as something that's very, very real and prevalent in their patients, and to be thinking about that every time that they have interaction with their patient. So the first thing that I created was this Word document, which is a 16 question multiple choice quiz or a survey. This is a pre-survey, and it is designed for the nurses to just kind of get a baseline grasp of what do they already know currently. And with this information, I was able to take this, create some education, and then go the next step, which will be the evaluation, which will be this exact same quiz, exact same wording to figure out how much they actually grasped and learned during the education that we choose to implement next week. So this is just a Word document, but I'm going to show it to you here and how I presented it to the actual nursing staff. I used a platform called Quizzes, which I was able to email the link to all the nurses on the floor, as well as a QR code, so that the nurses could do a QR code to access this on their time. So if you look at the nurses will go to the link, they'll put their name in here, they'll click start. It will bring them up into a quiz, which we hit start game. You can see it's got some cheesy music, but which of the following is correct here? Select all the options that apply. It has different options, so some are multiple choice, some are true and false. But I'm just going to click 2 here just to see. Click submit. And it will tell if the answer is correct or incorrect. Among adults with sepsis, the 2 most common sites of infection were blank and blank. I'm going to click lung and urinary tract, and that was correct. So the nurse would get points for that. I'm going to exit this and go back to the Word document here. So I was able to take all of these questions and put it into kind of a fun, user-friendly, kind of eye-catching way of doing a quiz that did not feel like a quiz. It actually felt more like a game. And then I am able to get feedback instantly on that to look at how many questions that they answered correctly, how many they answered incorrectly, and kind of get a gauge of where to go from there. But if you look at some of these questions here, I have everything that kind of talks about risk factors, talks about some ways that they can get the infection, talks about some sepsis criteria, some challenges, SIRS, etc. So that's what I choose to use there. Then looking at the actual PowerPoint that I choose to use, this here is the actual PowerPoint presentation that I plan to go through with the staff next week at our staff meeting, which is Wednesday, November 1st. And we pretty much everything that was on that quiz is incorporated into this PowerPoint, and additional some other things as well. But this PowerPoint here, as you can see, It talks about some aspects of what is sepsis, what sepsis is not, and then it kind of goes into an actual way of what is a definition of looking at the different steps that sepsis can progress and take. Also, SIRS is involved in that as well. Some facts of sepsis. These are some things that I want people to kind of look at and go, wow, I never really understood the sheer impact that sepsis actually has. And want our nurses to be able to identify some of these, just kind of get a gauge of where we're at with sepsis. Some risk factors of sepsis. What are some causes? Sepsis recognition within our nurses. I want them to begin to recognize and realize that early detection of sepsis with the timely appropriate interventions increases the likelihood of survival. So early detection by nurses being able to identify and detect and understand, wow, this could be sepsis, and alerting a physician, they could be potentially saving lives in this process. When should the nurses be concerned? Some sepsis interventions. These are some things that could potentially be seen. It's often called the sepsis bundle, but at this time in our hospital, we do not have a sepsis bundle. As shared earlier, we do not have a protocol. So these are just some interventions that could potentially be seen at this point in time. Looking at some potential consequences of sepsis. This is patient education. So I'll show you here in a different slide, but these are some things of that nurses, I want them to be able to identify and see and be able to talk to their patients about. One of these, this one right here, we are looking at planning and actually putting in each of the patient's rooms so that they can look at and see and be able to know some symptoms at home on when they should call 911. This is one of the most important slides in the very last slide of the presentation, but it talks about, could it be sepsis? It's a question that I want every nurse to ask when they walk into a room. Could it be sepsis? So simply, when you walk into a room, you're looking at your patient, ask yourself these three questions. Do you suspect a new or a worsening of an infection? Are 2 or more SIRS criteria present? And are there signs of new organ dysfunction? These are 3 questions that need to be asked. If they're asked and actually taken seriously, it could potentially alert a physician of an early sepsis brewing, which could lead to saving lives, could lead to cost reduction, and could lead to many, many more benefits for the patient. So going back here, if you look at this here, these are the faces of sepsis. This is a poster that was created by the Sepsis Alliance that I would like to be able to print and put in each of the patient's rooms, that it talks about pretty much anybody can get sepsis. Obviously, we know there are specific risk factors, but pretty much anyone here you can look at, and sepsis is not specific for certain people. It can happen to anyone. And so these are the 4 things that I want patients to kind of think about. Think about its time. When it comes to sepsis, it's about time that we start to take this seriously. If a patient has a high temperature or a low temperature that's abnormal, if they're not feeling very good and they have an infection, they start to get a little bit altered in their confusion, or they get more sleepy, and they are extremely ill. They have discomfort, they have shortness of breath, severe pain. They need to go into a hospital and say, I'm concerned about sepsis. This page here is a poster by the CDC that I would like to, let me see if I can make this bigger here. No. This is a poster that I plan to put up in our break room on our bulletin board. It just talks about protecting your patients from sepsis. It's kind of a wrap up of everything that I've already spoken about. As you can see here, it's got some statistics that kind of shows the impact and the seriousness of this illness. Talks about what are some causes of sepsis, some infections that can lead to sepsis, and who's at most risk for sepsis. Pretty much all of these patients here are patients that we do care for, apart from the children younger than 1. These are all patients that we currently are caring for on the med-surg floor at the hospital. And so nurses need to realize that our patients are at risk of having this. And then what are some of the signs and symptoms of sepsis? These are some of the key things that nurses need to be alerted to. If they see these, they need to start asking their questions. Wow, does my patient have an infection, and are they having some of these symptoms? If so, we need to act fast, and we need to contact a physician and start to intervene for this patient immediately. So as you can see here, know the risks, spot the signs, and act fast. It's something that we need to do as nurses. So overall, in a nutshell, I chose to do a survey up front to kind of identify a baseline knowledge of our nurses regarding sepsis. Then I chose to implement a PowerPoint presentation, which I'll also have the slides present, and a 8x11 binder where the nurses can go through the slides and look at them on their own. We choose to do some patient education on this. I'm going to post this poster in our break room so that the nurses can have kind of upfront information when they need it. And then last, I choose to do the post survey and kind of see if nurses learned anything, if there was actually some outcomes from this education, and to see if there was an increase in score. That is the goal, and that is what we choose to see happen. So overall, I'm excited about this project, and I hope that these different slides and brochures and PowerPoints will be effective for our nursing staff.